Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. We are here today with Miss Natalie, who is from Edwardsville, Illinois. And Natalie came today with her father to get a re-examination from us. She came originally back, it was in November, Natalie? In November of last year, and came to us with some fairly significant issues. What were the issues you came to us with, Natalie?
I was having lots of digestion problems, chronic fatigue, that was one of the main things, and eczema and severe acne breakouts.
You had eczema, severe acne breakouts, chronic fatigue, you were tired a lot, and you had digestive issues, okay? And those are actually problems with the skin, problems with the GI tract, fatigue. These are all issues that are quite commonly seen together, and rather than patients who are oftentimes patients come to us and they're seeing the dermatologist and they're seeing the gastroenterologist and they're seeing the internist, somebody for the skin, somebody from the stomach, somebody from this and for that. These problems we find are usually interrelated. So if we get down to the core issues, oftentimes we're able to address them simply and effectively. Now, Natalie, remind me also, when you came in, you had was it an ultrasound? You had a study of your gallbladder, and tell us about that. What was that about?
They thought maybe I was having some issues with my gallbladder because I was having a lot of pain in my side, and they found that I had sludge.
Sludge, the infamous sludge. So you had sludge in your gallbladder. Were they making any specific recommendations in regards to the sludge?
They wanted to do a CT HIDA scan to look at the functioning, and they were most likely they wanted to take it out.
The gallbladder. So they wanted to expose you to a high amount of radiation with a CT scan and then remove one of your organs. Okay, which fortunately you didn't do, did you?
No, I did not.
Okay, well let's talk about, so you came down here with these problems, the digestive issues, the chronic fatigue, the gallbladder sludge, the skin issues, which I think were a particular concern for you, as with many people, because that actually shows, you can see that on your face, the eczema and the acne. And when you came down here, what were your major objectives? And those were your problems, and your objectives were what?
I wanted to get well. I wanted to have the energy. With being in graduate school, I wanted to have the energy.
And what are you studying, by the way?
Speech-language pathology.
Okay.
Yes, so I wanted my skin to improve. I just wanted to feel normal again, be back to normal.
Yeah.
That was my main.
And we see quite a few people now, Natalie. You're 22? 22 years old. And we see quite a few young people who are developing these problems, and unfortunately, if they follow if they find a medical pathway, they oftentimes get a lot of issues and negative consequences. For example, Natalie was facing the possibility not only continuation of these issues, but also having her gallbladder removed. What was the medical approach to all these issues prior to your coming to see us?
Antibiotics.
Antibiotics. And how many courses of antibiotics had you been on?
Too many.
Too many to count?
Yeah, I was on a lot because I was prescribed one, and then I got an infection most likely from that, and then I had to be prescribed another antibiotic, and it was kind of like a vicious cycle.
Yeah, and we see this quite, and those antibiotics were being prescribed for your skin.
Skin first, and then from that I had like a UTI that I had to be, which was probably caused by the ones from the skin, and then there was another one in there too. I don't even remember what it was for.
And that's what happens when we start addressing problems by addressing symptoms. And too often with antibiotics, and we see this with steroids and other drugs too, one drug follows another drug, and then a drug to deal with those side effects of that drug, and meanwhile the patient doesn't really get a hold on what are the conditions actually creating the health problem so they can address it. What have been the results of your following the advice that we've given you here at the clinic?
I've seen major improvements in my energy, my skin especially. That's kind of what I was watching to see. I mean, my digestive system issues resolved fairly quickly. but I was really watching my skin to see, like, once that went away, like, my eczema is completely gone, or eczema, it's completely gone.
Your eczema is completely gone now.
And my face is cleared up for the most part, like, significantly.
Okay.
There's been a significant.
All right. So, and this would be the sequence we would normally expect is your digestive problems first improve, which allows the proper digestion of carbohydrate and protein and fat, so you're able to absorb those nutrients along with vitamins and minerals. And then as that happens, as you're transforming food into healthy flesh, then other problems start to clear up too, such as your skin, which now looks quite good.
Thank you.
Yeah. And did you go through kind of a rough time at first when you started following our advice? And this, is a major challenge that we have at our clinic, is people need to understand that sometimes as they begin a program and we're starting to undo the damage that's been done and clear out waste products, there's going to be some bumps on the journey, as we call them. Tell us a little bit about what happened with you when you started following the plan that we gave you.
I got sick quite a few times, and it seemed like every time I got sick, I would feel a little bit better afterwards.
Right.
And I would get sick again, but I knew this was kind of coming. And everyone else, who was watching was like, why are you getting sick all the time? Are they really helping you? My husband questioned a lot whether or not I was actually getting better.
Yes, I remember Dr. Tenner saying you talked with your husband a few times. This is over a relatively short period of time.
Yeah, he was getting really frustrated because I kept getting sick, and I'm like, just wait, I feel like I'm getting better. I know I am. And I think since the last time I really turned a corner, and I felt significantly better.
And in fact, you went back to the hospital. You checked at one point, didn't you?
Mm-hmm. Yeah, I had this. My body was basically like purging. It seemed like it was just purging, a bunch of things out. For like a week, I was just really, really sick. And
we almost did a physical exorcism on you then. Yeah.
Yeah. The main reason I went to the hospital was because I was just really dehydrated. I couldn't keep any fluids in. But after that, I felt great.
Did they look at that gallbladder again at any point?
Yes, I forgot to mention that. They did. They did another ultrasound on the gallbladder because they thought maybe it was causing...
So this gallbladder that was all full of sludge before you came to see us, they did a follow-up gallbladder ultrasound, and what was the result of that?
It was clear.
It was clear.
No more sludge.
No more sludge.
Yeah.
So, as the cells have the opportunity, we're creating the right conditions for health, and the cells begin to unload their toxic waste, including things such as sludge, in Natalie's case from her gallbladder, then patients are going to experience some symptoms. And some people at that point get very worried, and your husband did, and we understand why. We have to kind of talk people through that. And you had the good sense and the determination to see it through. And now here we are about 4 months later, and if we were to look at the overall percentage improvement, your fatigue, your skin issues, the eczema, the acne, the gallbladder sludge, and just the general way that you feel, about what percent improvement are we looking at this point?
I would say 90%.
We're real happy to hear that, 90% improvement. And the best thing about all this is that we hope at the Goldberg Clinic that now we're going to give Natalie the tools that she needs so that she doesn't have to be dependent on any doctors in the future, including, by the way, us, Dr. Tenner and myself, so that she can turn health care into self-care. And that's the way we see it here. We're not into all kinds of government health care or private health care. We really like to see patients learn to do the right things that put health care in their own hands. Well, thank you very much for coming today. And also, can you put the video camera on Natalie's father, Mr. Mortimer? Mr. Mortimer, thank you for coming also. And can I ask you also, sir, have you seen improvements in your daughter?
Absolutely.
Okay.
Big improvements.
All right, excellent. Okay, excellent. All right, thank you, Mr. Mortimer. Thank you, Natalie. Very happy to all the improvements that you've had.